Have you been told you've got IBS, but your symptoms never seem to go away, even when you try a low FODMAP diet and the other approaches? There's a reason for that. 1 in 3 IBS cases could actually be something called SIBO. And the worst part is most doctors don't test for it. Okay, now we've tested and treated this in thousands of clients across North America, Australia, and Europe. And in this video, you'll learn exactly if you should suspect you have SIBO, how to test for it, and what your results actually mean. And we'll even walk you through a real test and show you what those numbers reveal and what to do next if it's positive. My name is Joe Leach. I'm a qualified dietitian and I run the world's largest gut health clinic. In fact, I've been teaching about gut health, the low FODMAP diet, SIBO, and all the rest right here on this YouTube channel since 2016, which was long before gut health was mainstream and even trendy. Let's begin. SIBO stands for small intestinal bacterial overgrowth, and it's exactly what it sounds like. You've got bacteria growing in the wrong place, the small intestine, where they're not supposed to be in such quantities. And so it causes gas, bloating, pain, diarrhea, constipation. And because the symptoms overlap with IBS, most people never get tested. They just get told they have IBS and to deal with it. Now let's back this up for a moment with some actual data. According to a large 2023 review published in PubMed, which is the national research database in the US, SIBO was detected in 34% of people with GI complaints who underwent the breath testing. So that's 1 in 3 people with gut issues actually had SIBO. Now in the same year, another study, this one was from France, found that out of 247 IBS patients, 36.4% of them had SIBO. So that's slightly more than 1 in 3. The reviews also found that SIBO is more likely in people who have used proton pump inhibitors or PPIs, experienced constant bloating, abdominal pain, or even low iron, which is called anemia. If they have IBS with diarrhea, IBS-D, more so than IBS-C, had food poisoning, and that could have been the main trigger of their IBS symptoms in the first place, and are older than 65 plus because SIBO risk increases dramatically with age. And here's the thing, this isn't some fringe topic anymore. There's been a huge surge in research interest. The number of studies is doubling every 3 years. In fact, when I first started talking about this on YouTube back in 2016, please don't go and look those up, by the way. The production quality was terrible. I'm sure the info was good, I hope. But yeah, SIBO was still considered, functional medicine territory back then. But now even some conventional doctors are starting to diagnose and treat it, though many still miss it entirely. And that's why I'm doing this video. If you're listening to this and thinking, wait, you know what? I think I have SIBO. Well, don't ignore that gut feeling. I'm sorry, that was a dad joke. I'm not even a dad yet. I couldn't help myself. But we can help you get tested and figure out what's really going on. So just check the first link in the description below. We'll walk you through how our program works and see if it's a fit for you. And if you're still navigating food triggers and haven't grabbed this yet, the second link in the description is a free low FODMAP food list you can download today. The only reliable way to diagnose SIBO is with a breath test. And that's important, not just to confirm whether SIBO is present, but to figure out what type of gas is being produced in your gut, because that changes the treatment entirely. To help you understand this, I asked 2 of our expert dietitians on the Diet vs. Disease team, Victoria and Emily, to walk us all through a case study using the results of a SIBO breath test. So you can see exactly how we interpret those results, and what symptoms make us suspect SIBO in the first place.
My recommendation for all of my clients are always test, don't guess, just because you rather know what you're dealing with versus just kind of throwing random things at it. So I do have a sample SIBO test that we like to run on our clients. This one is going to test for specifically hydrogen and methane based SIBO. So there is a third type of SIBO, which is hydrogen sulfide. And these are the gases that are produced in the gut to make that bacteria kind of feeds on, and it produces this gut, which can create those uncomfortable symptoms. So the bloating, the gas, the constipation or the diarrhea that you experience, the belching, things like that. So what we're looking at here is, here is an example of a hydrogen and methane breath test. And what visually you're going to see is it's going to be throughout a 3-hour time period, right? So you are looking at what does the gut kind of look like in the beginning of the test, and then throughout 3 hours, you'll kind of see, does anything kind of get elevated? This black line is going to be methane, and this blue line is going to be hydrogen. So we can kind of see where the gases are being produced for either one of those. And what you do is you have to follow a specific diet beforehand to make sure there's none of those fermentable carbohydrates that are kind of sitting in the gut and that your bacteria kind of going a frenzy for and eating all of those. And then at vial 3 is when you actually intake a substance called lactulose. And that is a pore absorbed sugar. So that the bacteria, if you have small intestinal bacteria overgrowth, that bacteria kind of goes in a frenzy, starts eating off of that. And then if you have SIBO, you'll see a raise. Now, in this particular stool test, this person has pretty severe methane SIBO because even at their baseline, they were elevated here. So what we look at when we're analyzing these results are, is there a change in the hydrogen production or is there a methane peak? So you really don't want to see, but beyond this 90-minute mark, it greater than 20. So for this client, she was lower in this hydrogen, never raised really above 20. So this would be negative for hydrogen SIBO. However, for methane, like I mentioned, they had an increase of above 81. And with methane, it's actually, if you have anything above 10 for any point in the testing, then that's considered a positive test. The tricky part with these tests, and this is why I highly, highly recommend if you suspect SIBO working with a practitioner, is because there are some nuances to the test. So sometimes people can have like an 8 value or a 9 value and have a lot of symptoms. So even though it's not a direct positive test, if you're having a lot of symptoms and you're kind of borderline, that may indicate that we need to address something or intervene somehow, provide some type of intervention to help the symptoms kind of go away and to also hopefully prevent it from getting even more elevated in the future.
Is there more to the report underneath that you would go through, or like?
Yeah, so when I explain like a result, we kind of will talk through some of these. So this kind of helps explain it a little bit more for more understanding. So it talks about like, is there a potential for the hydrogen? So a rise of hydrogen above 20 parts per million over baseline in the first 90 minutes of testing is considered positive for a SIBO test. So we'll kind of go through and see how elevated their values are and kind of explain how aggressive do we need to be with the intervention or the treatment that I'm going to recommend. And then same thing for methane. So it kind of talks about a peak methane level above 10 parts per million at any point is indicative of a methane positive result. But like I also mentioned, there's some nuance where even if values are between 3 and 9, so this goes a little bit lower than even what I said, but it can indicate a need for clinical intervention if the patient is extremely symptomatic. So that's where, like I said, working with a practitioner can be really helpful because analyzing these tests can be a little bit more complicated than just, yes, it's positive or no, it's negative.
Okay. And so would you say which one's more common then, hydrogen or methane?
I personally see methane a lot more commonly than hydrogen. The other tricky part is that sometimes in some instances, if you have like a borderline hydrogen piece and you have a high methane piece, sometimes those methane producing bacteria like to gobble up the hydrogen. So sometimes you could even treat your methane and then end up being actually high in hydrogen once those hydrogens can kind of start to become overgrown and that methane drops a little bit more. So I would say overall methane is more common, but it's not to say that I don't see hydrogen just as often.
Okay, so let's break that down in plain English. What you just saw was an example of a SIBO breath test and how we interpret the results to figure out what's really happening in the gut. And essentially, there are 3 types of gas we're looking for from the test: hydrogen, methane, and then sometimes hydrogen sulfide, though that one isn't picked up on all the tests. Now, each type of gas is created by different bacteria. And each one causes different symptoms like bloating or diarrhea or constipation. So think of your digestive system like a freeway. So hydrogen producing bacteria are like reckless drivers speeding and weaving through the traffic. They cause diarrhea and bloating. Now the methane producers are the slow drivers. They're hogging all the lanes and really everything's getting backed up. They're causing constipation. And when both show up on the freeway, it's like rush hour chaos with no way out. Symptoms flip between extremes and it's nearly impossible to predict what your gut will do next. And that's why this kind of testing is crucial, because it tells us not only if SIBO is present, but what type, because that changes how it gets treated. So if food changes alone haven't helped, that might be because the root cause, like SIBO, hasn't been addressed. So make sure you tap the first link in the description to learn how we help clients test, treat, and recover fully. And whether you're new to FODMAPs or you want to clear a list of safe foods, the second link in the description is a free download to get you started. Before we get to treatment pathways, I need to highlight the risk of recurrence. That's what makes SIBO so tricky, because while the process is simple to follow, it's not necessarily easy. So it's simple in that once we know what is going on, it's a matter of like, if X, then do Y. But it's not always easy to implement that. And one of the main reasons for that is recurrence, which is very common in SIBO, something like 30+% of people. And that is something many overlook, including the healthcare system. So Emily, one of our other experienced dietitians on our team, explains this with Victoria in more detail.
And I think sometimes too, we review them a little differently if it's a retest, the idea of administering a second test after they've had the treatment, I think is a huge gap in like the system with the doctors right now, just because I find so many of our clients don't get that retest and then they come to us thinking they just kind of have, lingering IBS symptoms, but maybe they never fully got rid of the SIBO or it came back. But even just that idea of not fully getting rid of it, it's so important to know that they were maybe initially super positive for methane, like this person here, where it's honestly pretty likely that maybe they need 2 rounds of treatment or, that we see it reoccurring.
Yeah, so I just want to throw into, I believe if I remember the stat correctly, and Emily, you probably can correct me if I'm wrong, but I think it's like it's like 30 to 40% chance of recurrence when it comes to SIBO. So that's something to really be familiar with. From my experience, methane SIBO, so if you have the higher in the methane gases, that's a little bit harder to treat than the hydrogen. So that sometimes can take a little bit more work in treating that. But I agree with what you said, Joe, in terms of like, it's simple, but it's not easy. So, and
and I would say too, it kind of depends on what we're suspecting is like the root cause of their SIBO as well, because say it's due to maybe like we're suspecting abdominal surgeries affected somebody's ability to digest food normally and it causes some of these symptoms that we see with SIBO, that's not as easy to address via like diet or medical intervention compared to maybe somebody that I don't know, just has chronic constipation and we can help resolve that, via nutrition and supplements. But yeah, I think at this point, the evidence gives us enough ideas of how to treat it. And it's not so much a hesitation around that, but it's just the idea that did we fully get rid of it and could it come back or did it come back if the same symptoms are still there?
So as Emily pointed out, this is where a lot of people get stuck. They get treated once, but don't get retested. So if symptoms return, they're left thinking, it's just IBS again, when in fact, the SIBO was never fully cleared. So it's like finding mold behind the wall and then you're treating it once and assuming that it's gone without checking if the moisture problem is still there. So when you have a result and a diagnosis, how do you treat SIBO properly? Well, there are a couple of different proven methods. So let's go back to Victoria to explain the next steps from a nutrition standpoint, as well as exploring antibiotics versus antimicrobials.
So like Joe had also mentioned, there are 2 ways to kind of treat this. In this case, because their levels were so elevated, I actually referred them to their gastroenterologist, just because in this instance, antibiotics would be the best option just because levels were so elevated. So I had them follow low FODMAP diet just to reduce those fermentable carbohydrates from exacerbating anything a little bit worse. And then referred them to their gastroenterologist for specific antibiotics that are shown to help kind of get rid of the methane bacteria overgrowth. And so that's usually a 2-week course. And then we also supplemented with some other supplement, like a specific probiotic to kind of help keep that beneficial bacteria in good standing of whatever she had. And then we kind of just monitored and saw if symptoms improved or not. We actually did retest for them. And then we actually did an antimicrobial round afterwards. So there are 2 ways you can kind of go about treating SIBO, but it's really going to depend on your history, your situation, how elevated it is, what kind it is, and the type of antimicrobials that are recommended are also going to be dependent on what type of bacteria is producing those gases.
So the antimicrobials, do you want to just explain quickly, not necessarily what they are specifically, but how are they different than the antibiotics from the gastro? And then why, and when and why did you go the antimicrobial route afterwards?
Yeah, so depending on the type of antibiotic that your doctor will prescribe for you, it can either be localized to the gut or it can be systemic. So you have to be careful with overtreatment. I mean, with both antibiotic and antimicrobials, but specifically with overtreatment of antibiotics, like if you got into that situation by having so many antibiotics, it may not always be the best recommendation. Like, yeah, let's put you on more antibiotics, right? Because that could just exacerbate the problem. They didn't have any history of that, so I felt comfortable that let's kind of bring it down enough. So antibiotics are usually a shorter treatment. It's 2 weeks. Like I said, depending on the type of antibiotic, it can be localized to the gut, but more likely than not, it's usually systemic, which means it affects the whole body. Antimicrobials usually are a little bit gentler. People don't usually have as much as side effects from the antimicrobials. It's a natural agent, so you can get it over the counter as well, but it does take a lot longer to treat it. So you're looking 2 weeks for antibiotics versus like 6 to 8 weeks for antimicrobials. In their specific case, we did the antibiotic round, waited about a month to see how symptoms kind of progressed, but she was still having severe symptoms. So that's when we retested, saw that the levels went down, but they actually kind of shifted, like I mentioned. So the methane was still pretty elevated, but then the hydrogen kind of shifted as well. Her gut was still kind of sensitive after doing the round of antibiotics, which is why I kind of made a shift to do antimicrobials, because like I said, sometimes it could be a little bit gentler in that regard.
And low FODMAP diet throughout this process?
Yeah, so usually I would do low FODMAP diet throughout the entire process until they're starting to see some symptom improvement. And then we start to go through the reintroduction phase of trying to bring foods back in, because at the end of the day, you want as much variety as possible to help feed the beneficial bacteria, but you don't want to be exacerbating the problem by you're feeling so bloated and uncomfortable and you're eating these foods that are making that bloating and comfortability worse. So you really want to find out what foods are exactly causing those symptoms.
All right, so let's unpack what you just heard because it's a lot, right? So treating SIBO isn't just about wiping it out once and hoping for the best. It's about doing the right treatment and then supporting the gut so it doesn't come back. So here's the big picture. There are 2 main treatment paths, okay? Antibiotics, usually prescribed by a gastroenterologist, or natural antimicrobials, which take a bit longer but can be gentler on the gut, I suppose. Both can be effective, but what matters most is choosing the right one based on your test results, your symptoms, and your history. And that's why this isn't a one-size-fits-all approach. And then, as Victoria said, we often pair treatment with a temporary low FODMAP diet and potentially a probiotic to reduce symptoms and inflammation while the bad bacteria die off. And then once symptoms improve, we guide clients through a structured reintroduction process to rebuild variety and figure out which foods actually trigger issues. Now, I asked Emily if she wanted to add anything to what Victoria said and also about the steps to prevent recurrence.
I agree with everything she was saying. And I think, yeah, when it comes to that specific probiotic she was referring to as well, that's known to be helpful in pairing with a SIBO treatment, either antibiotic or antimicrobial, to reinforce the good bacteria is so important, especially even like right after the treatment when we're trying to like see somebody achieve that at least like 90% symptom relief. But sometimes it does take a period of just having that good bacteria daily versus also the antibiotics that are wiping out bacteria whilst doing the probiotics. So yeah, there's often that window in which they're just, people need to eat low FODMAP to kind of keep that symptom control, like Victoria suggested, as well as adding some of that good bacteria to hopefully strengthen the gut a little bit. And then I think too, I always phrase it to people like, the more you're inducing symptoms right after the SIBO treatment, like the harder it's going to be for your intestinal lining to heal. So that's why we know too that, maybe you get relief during or right after the antibiotics or the antimicrobials. But if you just, throw your diet out the window, eat whatever you want, we still know that a lot of those fermentable carbohydrates are likely to cause symptoms, still even after the protocol. So if you're just inducing symptoms regularly, it's tough to feel like you ever kind of recover. So that's where the diet piece comes in. And then I think considering any other supplements that we know to kind of be anti-inflammatory or help support the healing of the gut lining is another component of it too, just depending, where the symptoms are at. And I think all that kind of plays into the reoccurrence as well, because again, if diet's not considered, sure, you can treat it, but if likely diet relates to a lot of these root causes, whether it be someone needing antacids because their diet is maybe exacerbating reflux symptoms, like can we eliminate something like that with the support of someone's doctor to prevent reoccurrence? Or, even just building up like your immune system, given that 70% of your immune system is in the gut, like can we, use the diet to build that up a bit too. So yeah, I think the nutrition part of it is super key for reoccurrence prevention, especially. Mm-hmm.
Okay, so likely so reoccurrence is often happens because after they treat it with antibiotics, for example, then the nutrition component maybe is not followed, or there's not a certain protocol or eating pattern followed. For example, a low FODMAP diet or something else that eliminates the problem compounds, but then also the reintroduction phase after.
Yep. And I think too.
Oh, go ahead. Sorry.
I was just going to say, and I think too, like that idea of identifying the triggers also kind of goes back to like keeping the symptoms at bay to allow the intestinal lining to heal. Such a big part of it is like knowing what foods trigger you in the first place. So if we're never getting to that reintroduction phase to even know what's triggering, then we're missing that whole piece. And I think the reoccurrence is, much more likely, like you said.
Yeah, so I was just going to add pretty much what Emily said, but we also go through like a gut repair phase. So there's certain supplements that we also would recommend in this instance, especially if you had really high levels, to just help kind of support your gut to repair that intestinal lining a little bit more as well, just to, again, help prevent that reoccurrence alongside with diet.
Mm-hmm.
Emily also mentioned something crucial there. The more you trigger symptoms right after treatment, the harder it is for your gut to heal and recover. So managing SIBO isn't just about the initial treatment. Okay, it's about rebuilding a healthy, resilient gut afterwards. And that often means adding the right probiotic at the right time, supporting the gut lining with specific diet changes and potentially supplements at some point, as I mentioned, and then gradually reintroducing foods in a way that builds confidence as well, not fear. If you skip those steps, even after treatment, you could end up right back where you started, bloated, frustrated, confused. That's why this process matters. Now, here's the reality of the situation for almost all patients today, and actually what really frustrates us. Still to this day, many doctors dismiss SIBO altogether. They'll either say, look, you've got IBS, just deal with it. Or they'll prescribe antibiotics without a test, which is risky because if it's not SIBO, antibiotics can actually make things worse, of course. Or they prescribe antibiotics with no dietitian involvement through the process, which ends in recurrence. We've had so many clients who, when they start with us, say something like, no one ever told me about this process. And that's the problem. SIBO still isn't routinely checked, even though it's common, it's testable, it's treatable, and it's evidence-based. And so if you're stuck with unexplained bloating, constipation, or diarrhea, especially if you are older than 60, 65 and your symptoms came on after food poisoning or antibiotic use, or your symptoms just never improved with the low FODMAP diet, don't keep guessing. Check the first link below in the description to learn how we help clients solve this and rebuild a healthy and resilient gut. And it includes ongoing one-to-one support, the testing, of course, accountability, community, and more. And the second link is for you if you want clarity on FODMAP foods. We've included a free food list to help remove the guesswork through that process. Now, if you want to learn how to actually do the low FODMAP diet properly without wasting weeks figuring it out, watch this next video. It's a full beginner's guide that shows you how to get relief, rebuild your gut, and feel normal again.